Health screening. In this topic, we will cover health conditions that affect physical activity and medication. Introduction. With the average population as increasing in industrialized countries, there is an increase in proportion of older adults, many of whom are at risk for developing non-communicable chronic health conditions. Older adults are generally less physically active than younger adults. In the presence of strong evidence linking physical activity to chronic health condition and increased physical activity to lower mortality and morbidity in older adults, it is imperative to develop a strong commitment to improving physical activity levels in older adults. Governments around the world have begun to produce national guidelines for physical activity and health for older adults. The main challenge is to find effective ways to support older adults to increase their physical activity and then to develop habitual physical activity behaviors. Individual health practitioners have an important role in discussing and making recommendations around physical activity. GPs should have sufficient understanding of physical activity prescription to make recommendations to patients about types, amount, intensity and frequency of physical activity for health gain. Inclusion of physiotherapists or exercise professionals for exercise prescription may prove to be a valuable addition to the general practice team. The health problems relating to physical inactivity are unlikely to be completely solved by individual health practitioners, and significant steps by governments and policymakers have to be taken to create environment that encourages participation in lifelong physical activity. Now we have health screening. Health screenings are tests that look for diseases before the client have symptoms. Screening tests can find diseases early when they are easier to treat. The client can get some screening in their doctor's office. Others need special equipment, so the patient may need to go to a different office or clinic. Some conditions that doctors commonly screen include the following: breast cancer and cervical cancer in women, colorectal cancer, diabetes, high blood pressure, high cholesterol, osteoporosis, overweight and obesity, prostate cancer in men. Now we have components of screening. Proper screening and risk stratification of clients who are starting exercise program is important for promoting exercise safety and preventing adverse events during exercise. Personal fitness trainer must be able to utilize the proper tools and understand the information gathered from the exercise screening. Components of this screening include healthy history questionnaire, next physical activity readiness questionnaire, next risk stratification and informed consent. Now we have HHQ and PAR-Q. The HH questionnaire and PAR questionnaire are critical first steps in the exercise screening process. They help exercise professionals to determine whether client need physician referral before starting an exercise program, to recognize clients who require exercise program modification based on physical limitation, and to identify clients for whom exercise training would be inappropriate or unsafe. Administering HH questionnaire to clients should be a standard procedure for all PFTs. However, the information collected using an HHQ may vary by facility. In general, HHQ should cover a number of basic areas. Number 1 areas, demographic information including healthcare provider information. Number 2 area, medical diagnosis including cardiovascular, pulmonary, metabolic and musculoskeletal disorder. The third area, history of symptom for disease, that is chest pain, dizziness, shortness of breath, palpitation, musculoskeletal pain, etc. Number 4th area, family history, that is primarily immediate family including mother, father, sister and brother. Next, previous physical exam, lab and exercise test result. Next, we have recent illnesses, hospitalization, medication and allergies. Next, we have health habits, that is diet, stress, tobacco, alcohol, etc. and exercise and work history. Next, pregnancy status. The PAR questionnaire is considered a minimal standard screening tool for clients starting a moderate intensity exercise program and should be used in conjunction with the HHQ. The PAR questionnaire is mostly used to identify when physical activity would be appropriate for a client or whether a client should seek medical advice before starting a program. The PR questionnaire consists of 7 questions referring to signs of symptoms suggestive of disease that exercise can exacerbate. The questions have simple yes or no answers. If client answer yes to any of the questions, they should be referred to as physician for further screening. Now we have risk stratification. Some of the most important items that should be identified with this screening tools are coronary artery disease, so-called CAD risk factor. This risk factor can be associated with overall promotion or development of CAD, that is 7 positive risk factor, or with the prevention of CAD, that is 1 negative risk factor. Interestingly, risk factors can be summed to obtain a total number of factors, with a negative risk factor cancelling out a positive risk factor if both are present. SCSM suggests that the list of risk factors are not be considered all-inclusive but rather be used as a guideline when determining if physician referral and further evaluations are needed before beginning a program. Once the HHQ and PRQ are complete, individual client can be evaluated based on their risk of experiencing an adverse cardiovascular event during exercise. According to the American College of Sports Medicine, so-called ASTHMA, PFT can stratify a client's risk using variables such as age, risk factor and symptoms suggestive of disease. The initial SCSM risk stratification screening defines 3 risk categories. Number 1 risk, low risk. Younger individuals who are symptomatic and meet no more than 1 risk factor threshold, that is from the CAD risk factor chart. Number 2, moderate risk. Older individuals, that is man more than 45 years of age, woman more than 55 years of age, or those who meet the threshold for 2 or more risk factor, that is from the CAD risk factor chart. Number 3, high risk. Individuals with non-cardiovascular or pulmonary disease, non-metabolic disease such as type 1 or type 2 diabetes, or 1 or more sign and symptom suggestive of any of these diseases. Now we have informed consent. The last step in the exercise screening process should provide an opportunity for all clients to give informed consent before beginning an exercise program. The informed consent document can vary among facilities, depend on client, staff, equipment, etc. But all informed consent should be written in an understandable manner and include certain basic information. That is, purpose of the consent, degree of exercise supervision, that is close monitoring, occasional monitoring. Next we have benefit and risks of exercise participation. Next, step or procedure that will be followed in an emergency situation. Next we have responsibilities of the client, that is reporting of symptoms, exercise program, adherence. Next we have statement covering confidentiality and freedom of consent to participate in the program. True informed consent can be obtained only when the personal trainer verbally communicate the meaning of the form to the client. That is, simply asking the client to read and sign it does not constitute informed consent. Provide an opportunity to answer client question before the client and witness add their signatures. Since most legal claims against exercise professional occur based on the negligence or malpractice, having a signed informed consent on file can help prove that the client intentionally engaged in exercise program after full disclosure and examination of risks associated with exercise participation. Now we have physical activity and medication. The benefit of exercise extend far beyond weight management. Research shows that regular physical activity can help reduce the risks for several diseases and health conditions and improve the overall quality of life. Regular physical activity can help protect it from the following health problems. If a person have a chronic condition, regular exercise can help to manage symptoms and improve the health. Aerobic exercise can help to improve the heart health and endurance and aid in weight loss. Strength training can improve muscle strength and endurance, make it easier to do daily activities, slow disease-related decline in muscle strength, and provide stability to joints. Flexibility exercises may help a person to have optimal range of motion about the joints, so they can function best, and stability exercises may help to reduce the risk of falls. Now we have heart diseases and stroke. Daily physical activity can help to prevent heart disease and stroke by strengthening the heart muscles, lowering the blood pressure, raising the high density lipoprotein, that is HDL level, that is good cholesterol, and lowering low density lipoprotein, that is LDL level, and that is bad cholesterol, improving blood flow and increasing the heart's working capacity. Optimizing each of these factors can provide additional benefit of decreasing the risks for peripheral vascular disease. Now we have high blood pressure. Regular physical activity can reduce blood pressure in those with high blood pressure levels. Physical activity reduces body fat, which is associated with high blood pressure. Now we have obesity. Physical activity helps to reduce body fat by building or preserving muscle mass and improving the body's ability to use calories when physical activity is combined with proper nutrition. It can help control weight and prevent obesity, a major risk factor for many diseases. Now we have osteoporosis. Regular weight-bearing exercise promote bone formation and may prevent many forms of bone losses associated with aging. Now we have self-esteem and stress management. Studies on the psychological effect of exercise have found that regular physical activity can improve the mood and the way a person feels about oneself. Researchers have found that exercise is likely to reduce depression and anxiety and help a person to better manage stress. Now we have diabetes. Regular exercise can help the production of insulin more effective and lower the blood sugar level. Physical activity also can help to control the weight and boost our energy. Now we have asthma. Often exercise can help to control the frequency and severity of asthma attacks. After this we have back pain. Regular low-impact aerobic activities can increase strength and endurance in the back and improve muscle function. Abdominal and back muscle exercise, that is core strengthening exercise, may help to reduce symptoms by strengthening the muscles around the spine. Now we have arthritis. Exercise can reduce pain, help maintain muscle to strengthen in affected joints and reduce joint stiffness. Now we have disability. Running and aerobic exercise has been shown to postpone the development of disability in older adults. After this we have conclusion. Many physical disorders have been identified that are more prevalent in individuals with severe mental illness, that is SMI, in addition to modifiable lifestyle factor and psychotropic medication side effects. Poorer access to and quality of received health care remain addressable problem for patients with SMI. Greater individual and system level attention to these physical disorders that can worsen psychiatric disability, treatment adherence and life expectancy as well as quality of life will improve the outcome of this generally disadvantaged population worldwide.